Hi friends, I've brought in a video for you. This video is going to be on Visavit. Visavit are multivitamins and multimineral tablets which contain antioxidant vitamins such as beta carotene, C, E and minerals zinc, copper, selenium, folic acid and vitamin D. This box contains 30 tablets. It's made by Remington Pharma and the price for one box is 245 rupees. Vitamin deficiency anemia is a lack of healthy red blood cells caused when you have lower than normal amounts of certain vitamins. Vitamins linked to vitamin deficiency anemia include folate, vitamin B12 and vitamin C. Vitamin deficiency anemia can occur if you don't eat enough foods containing folate, vitamin B12 or vitamin C. Or it can occur if your body has trouble absorbing or processing these vitamins. Some symptoms of vitamin deficiency include fatigue, shortness of breath, dizziness, pale or yellow skin, irregular heartbeats, weight loss, numbness or tingling in your hands and feet, muscle weakness, personality changes, unsteady movements, and mental confusion or forgetfulness. Vitamin deficiency usually develops slowly over several months to years. Vitamin deficiency signs and symptoms may be subtle at first, but they increase as the deficiency worsens. Vitamin deficiency anemia develops when your body has a shortage of vitamins needed to produce enough healthy red blood cells. Red blood cells carry oxygen from your lungs throughout your body. If your diet is lacking in certain vitamins, vitamin deficiency anemia can develop. Or vitamin deficiency anemia may develop because your body can't absorb the nutrients from the food you eat. Causes of vitamin deficiency anemias include a deficiency in folic acid. Folic acid, folate, also known as vitamin B9, is a nutrient found mainly in fruits and leafy green vegetables. A diet consistently lacking in these foods can lead to a deficiency. Deficiency can also result in your body if your body is unable to absorb folate from food. Most nutrients from food are absorbed in your small intestines. You might have difficulty absorbing folate or folic acid, the synthetic form of folate that's added to food and supplements, if you have a disease of the small intestine such as celiac disease. Pregnant women and women who are breastfeeding have an increased demand for folate, as do people undergoing dialysis for kidney disease. Failure to meet this increased demand can result in a deficiency. Some risk factors of vitamin deficiency include if your diet contains little to no natural vitamin food sources such as meat, dairy, fruits and vegetables. Vegetarians who don't eat dairy products and vegans who don't eat any foods from animals may fall into this category. Consistently overcooking your food also can cause vitamin deficiency. If you're pregnant and you aren't taking a multivitamin, folic acid supplements are essentially important during pregnancy. If you have intestinal problems or other medical conditions that interfere with absorption of vitamins, abnormal bacteria growth in your stomach or surgery to your intestines or stomach can interfere with the absorption of vitamin B12. If you abuse alcohol interferes with the absorption of folate and vitamin C as well as other vitamins. You take certain prescription medications that can block absorption of vitamins. Anti-seizure drugs can block the absorption of folate. Antacids and some drugs used to treat type 2 diabetes may interfere with B12 absorption. So the solution for these problems is to use a good quality multivitamin like Visavit. I hope you like the video. Please like and share our channel, subscribe to our channel. Thank you.